Yeah, right. Forget all the treats in that 2,000-page healthcare bill. My next guest says, get ready for the tricks. Or in this case, amendments. Enough to make this bill so big, even our world's fastest speed reader will have a tough time cracking it. And if Roy Blunt is right, enough to make its $1 trillion price tag look like chump change. The Republican congressman from Missouri joins me now. Congressman, $1 trillion will be made to look like chump change? What kind of number do you have in mind?
Well, I'm afraid in the long run we're talking about a lot more money. You know, Stuart, it seems to me listening to you talk about this whole health care debate for weeks now, maybe months now, you've got it the whole time. If this was the greatest health care bill in the world, we should be saying, well, we just can't afford it. It'd be wonderful if we could do it, but we can't afford it. This particular proposal, all these proposals, have the disadvantage of having real failings in addition to costing taxpayers lots of money. I think now the CBO score, the Congressional Budget Office score, is up to $1 trillion in the first 10 years. And remember, you don't spend very much of the money until year 7, 8, 9, and 10. You collect money, you cut Medicare and do other things for 10 years, yeah, but you only spend money for less than a handful of years. So we're talking about lots of money and lots of pages, a bill that could very well ultimately die under its own weight.
So, right, it's going to cost, you think, a lot more than $1 trillion over that 10-year period. But what about what's going to be added into it? We just referred to amendments, which you think are going to be stacked into the 1,900 pages we've already got. Will these amendments be added and we don't know what they are?
Well, I think the majority leader has said that he'd plan to have the manager's amendments available for 3 days, maybe, before the bill goes to the floor. But, of course, if you'd ever taken a test on a 2,000-page bill and then a couple of days before the test somebody says, okay, here are the 4, 5, 6, maybe 800 pages of changes, figure out what you've got then. This is a real problem. You know, I'm sponsoring 9 different bills that would do individual things in health care, none of which I think are 100 pages long, but all of which you could look at and say, oh, that's medical liability reform, that's access for the other bill's access for everybody, regardless of pre-existing conditions. This doesn't have to be a hide-the-ball sort of legislative effort.
But that's what it is.
Clearly, that's what we're into now.
That's what it is.
I think that's exactly what we're into.
You know, we've got some video of the speed reader right up there on the screen right now, and he's just flashing through. I don't know how he does it, quite frankly, but he's going through page after page after page. I mean, we can't do that.
I bet the speed reader's not a speed retainer. I bet the speed reader.
I think you're right.
It would really be amazing if the speed reader actually understands at the end of the page what he's read.
But do you think America will stand for this? I mean, dumping on us 72 hours before there's a vote, a massive tome, which you say is going to cost a lot more, with amendments which we can barely read. Do you think America will buy this?
You know, in August, America wouldn't have bought it. You know, people can only maintain a level of outrage for so long. They've got to make a living and pay the bills and raise their families. And, you know, if just seniors figure out that they're going to be asked to pay for this with $500 billion of Medicare cuts and start contacting members of Congress, this won't happen. The question is whether the American people really figure out the overwhelming cost, and even the people who like the bill shouldn't be willing to pay the price.
I got to tell you, Roy Blunt, I can barely wrap my arms around the whole idea of $1 trillion, but I guess we're going to have to.
Well, nobody can. Nobody knows how much money that is. That's exactly right.
Nobody can. Roy Blunt, a pleasure. Thanks very much for joining us, sir.
Good to be with you, Stuart.
Yes, sir. All right,